And let's turn our attention to the economy over in the state of Hawaii. As Emily pointed out, hardest hit by the pandemic, the unemployment rate hovering just about 9%. The state is optimistic, though, about a big bounce back. At least one local agency pointing to a 6.5% growth this year. Let's bring in the Lieutenant Governor of Hawaii, Josh Green. He joins us today. It is great to have you on today. That's a pretty optimistic number. It feels like things have started to pick up over the last several months, at least with tourism. How much of the broader recovery do you think is contingent on getting the federal aid that has been laid out by President Biden's plan?
Well, thank you for having me. It's contingent on federal aid and our ability to reopen the state. Those are the two largest factors. You have to realize not only are we at 9.3% unemployment now, we spiked to 23% unemployment when our state shut down, and we decreased travel to Hawaii by 99.6% when the pandemic began to surge and crush our country. Now it's dropping very quickly because we're doing a good job with vaccinations. We're also really expecting a huge year for travelers once it can be done safely. And travel will be defined by our ability to vaccinate ourselves. So it's those two factors that will help Hawaii recovery. And we'll recover like we did after 9/11, which was a crisis different, but also affected travel.
Yeah, it's kind of shocking to look at how Hawaii's unemployment rate has fallen. I mean, we're talking about the Bureau of Labor Statistics data, but when you look at the weekly insured unemployment claims, just to see that percent fall when you go from having about 1/5 of Hawaii's citizens on unemployment insurance to where it's at now, it's a steep decline here. And I know you guys put a lot into testing. You guys were one of the first states. I know you're on an island. I know you have the benefit of maybe screening people a little bit better than what we have back on the mainland. But how much of that really goes to show what you can do when you do put effort into testing and focusing on the pandemic?
A lot. Thank you for that. It was a proof of concept that actually worked. We created a Safe Travels program, which we launched on October 15th. And we went from a disastrous situation to, well, let's just say a less disastrous situation, improving every week. We were able to do it with a pretest. So if people travel to Hawaii, they must get a pretest from one of our trusted partners within 72 hours. It's a nucleic acid amplification test, super accurate. That's the PCR test. If you get that test, you can come here. And all of a sudden our numbers went from like nothing to 10 or even 15,000 per day, which was somewhere between 35 and 50% of our baseline. I've proposed a new way to go, which is as we track vaccination status in our state and on the mainland, we begin to let people come here if they can demonstrate they've been fully vaccinated, plus 2 weeks, which gives them immunity. My other life is as a physician, and that's why I'm focused very much on immunity and then travel.
Let me ask you, sort of building on that question, though, there's been a lot of talk about potentially having sort of a second passport for travelers that would determine whether, in fact, the travelers, number one, have been tested and tested negative for the virus, but also whether they, in fact, have the vaccination to sort of ensure that they are, in fact, immune in some way. Where do you stand on that, and how much of that do you think will help in at least boosting confidence for travelers to get out there to places like Hawaii?
It'll be an absolute game changer. We're in discussions with Health Pass and Clear. These are companies that do very good work. There will be others, I'm sure, in the industry and in this market. A simple, protected set of information which shows that you're immune. I had COVID over 9/11, and then I've been vaccinated as a doctor. And so to be able to show that on an app on my iPhone will be very, very helpful. And it's not just for travel. It'll also be for events. For instance, if you want to hold a marathon in your city, it might be good to demonstrate that you've got immune runners. If you want to hold concerts again, or you want to have a Super Bowl, though I do hate both teams in the Super Bowl, you can have that Super Bowl and have people be in the stadium safely. So this is going to be important for us through 2021, 2022. It will drive economic growth and recovery. And for Hawaii, where we will need to get back to some larger portion of our travelers. We used to get 30,000 a day or 900,000 a month. We'll have to be safer, and that will be one way to do it.
I should note here, too, I mean, you're also a doctor, as you said. You still practice there. You're the only lieutenant governor that I know of that's also a medical doctor. So when you look at kind of the response you've seen in Hawaii and what could be applied to the U.S. as a nation, we've seen other nations kind of lock out international travel. We know more of that now kind of coming through here as we try and protect ourselves from the variants that seem to be already here in the country. But when you apply what Hawaii did to the nation, does it kind of show that maybe some earlier protections, if they were put in place, that perhaps the nation as a whole would be in a better spot?
Yes, if we had done essentially a safe travels program nationally, we could have decreased the cases coming in by about 80%. Also, variants, of course, track very closely because you just have to do the genetic analysis of the cases that you get. And it's good because when you have these safe travels program, you can isolate where people came from and then test those samples if they happen to be positive. So you can get a quick idea about the variants. Obviously, we're very worried about the B117 variant out of Great Britain. So there's lots of this that has to be done. We should apply all of this. And it was nice to see that the federal government did kind of emulate a little something from Hawaii, which was a derivative of the Safe Travels program. But also to have travel passports will be very helpful. We will still let people come here even if they don't get vaccinated. We're fair. We don't expect people to all get vaccinated. We don't force anyone. But then they would have to do the Safe Travels program. So multiple layers of safety gets you there. And that's how you expand your economic footprint again. We were devastated, but we will be back down to 4 or maybe even lower percent unemployment again as soon as we get through this vaccination process and get into a place where our elders are safe.
Let's talk about the impact of small businesses. No question, a lot of the small businesses in your state certainly very reliant on dollars coming in from tourism. I'm looking at the data from the previous Paycheck Protection Program early on in the pandemic, $2.5 billion from roughly 25,000 companies in Hawaii. What's your expectation this time around? And what are you hearing in terms of how significant that support has been, especially for small businesses in your state?
Well, I'll say it's critical. It's critical support for the many small businesses. The small business community was hit the hardest in our state, harder than our public workers who we did not have to furlough. The gov has considered furloughs, but it hasn't happened yet. The small businesses just totally got crushed. And of those loans that they got, a very small percentage of people have been able to get forgiveness so far, though we're ramping that up going forward. I expect a lot more PPP loans. That's how we're going to get through the kind of edgiest part of this crisis. But I think Hawaii will be open pretty well before Labor Day. I think that we will be the most open, most safe state in the country. And there's a clear idea that a lot of people have pent up desire to come back to paradise because our case counts are lowest in the nation. Our mortality rates are lowest in the nation. We just want to do it based on analytics and safely. But the small businesses have to recover. We have so many friends that hire 5, 10, 15 people, and that's why we do that to lower our unemployment.
Yeah, and it's shocking. I'll just hit it one more time because you're right. You went from being the highest unemployment rate in the country for any state in 2020 to dropping out of the top 10 entirely. So, I mean, just to kind of put a nail in it here, it was surprising to see the approval rating of your guys' as governor, the lowest in the nation, perhaps due to that surge earlier on in the year. But as you've dropped it down, I'm sure that approval rating might catch a boost. But when you kind of talk to citizens there on the island, what do you make of that and how people there are feeling about the response now?
Well, people are feeling a lot better. Our gov is a very good guy. He doesn't get out there like me as a big mouth and talk a lot. And so it's harder for him to celebrate some of the successes. But he's doing what he can. And as you can imagine, when you shut down travel that much, like 99+%, it really hurts. But on the other hand, we've only had, and I say only, please don't take this callously, 410 fatalities, lowest in the nation. When you match for the population on the mainland, we should have had 1,600 fatalities. We've had 25,000 cases. We should have had 125,000 cases. So the successes are evident about keeping people healthy and safe, but the economic fallout was heavy. Everyone understands that Hawaii will come back fast. We went from the lowest unemployment to the highest, and we will be back lowest again. It's going to really probably blow your minds, but that's how valuable the brand is for Hawaii and why we had to make sure people were safe.
Yeah, so much you guys got right over there, and we're seeing what could have potentially gone right here at a federal level too in the aftermath. But appreciate you coming on here to talk about that. Josh Green, a doctor and also Lieutenant Governor of Hawaii. Thanks again for coming on.